Question 1. Which drug can cause a dangerous hypertensive crisis when taken with tyramine-rich foods? A. Metoprolol. B. Monoamine oxidase inhibitors, MAOIs. C. Atenolol. D. Losartan. Answer. B. Monoamine oxidase inhibitors, MAOIs. Question 2. What is a common side effect of opioid analgesics? A. Hypertension. B. Constipation. C. Tachycardia. D. Diarrhea. Answer. B. Constipation. Question 3. Which antibiotic can cause tendon rupture as a serious adverse effect? A. Ciprofloxacin. B. Amoxicillin. C. Azithromycin. D. Doxycycline. Answer. A. Ciprofloxacin. Question 4. What adverse effect is commonly associated with long-term corticosteroid therapy? A. Hyperglycemia. B. Hypotension. C. Bradycardia. D. Hyperkalemia. Answer. A. Hyperglycemia. Question 5. Which medication requires monitoring for signs of lithium toxicity? A. Paroxetine. B. Fluoxetine. C. Lithium carbonate. D. Bupropion. Answer. C. Lithium carbonate. Question 6. Which class of drugs increases the risk of bleeding when taken with anticoagulants? A. NSAIDs. B. Beta blockers. C. Proton pump inhibitors. D. Statins. Answer. A. NSAIDs. Question 7. What is a life-threatening adverse effect of clozapine? A. Agranulocytosis. B. Hypertension. C. Nephrotoxicity. D. Hyperthyroidism. Answer. A. Agranulocytosis. Question 8. Which drug is contraindicated in pregnancy due to teratogenic effects? A. Warfarin. B. Metformin. C. Lisinopril. D. Simvastatin. Answer. A. Warfarin. Question 9. What electrolyte imbalance can be caused by loop diuretics? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. Answer. B. Hypokalemia. Question 10. Which medication can cause a persistent dry cough as a side effect? A. Beta blockers. B. ACE inhibitors. C. Calcium channel blockers. D. Diuretics. Answer. B. ACE inhibitors. Question 11. Which drug can cause severe lactic acidosis in renal-impaired patients? A. Metformin. B. Insulin. C. Glipizide. D. Pioglitazone. Answer. A. Metformin. Question 12. Which medication requires careful monitoring due to a narrow therapeutic index? A. Warfarin. B. Paracetamol. C. Omeprazole. D. Ranitidine. Answer. A. Warfarin. Question 13. Which medication may cause gynecomastia as a side effect? A. Spironolactone. B. Furosemide. C. Hydrochlorothiazide. D. Mannitol. Answer. A. Spironolactone. Question 14. What serious side effect is associated with statins? A. Myopathy. B. Hypertension. C. Bradycardia. D. Osteoporosis. Answer. A. Myopathy. Question 15. Which drug can cause severe hypoglycemia if taken in excess? A. Insulin. B. Levothyroxine. C. Lisinopril. D. Simvastatin. Answer. A. Insulin. Question 16. Which drug is associated with ototoxicity? A. Vancomycin. B. Amoxicillin. C. Metronidazole. D. Fluconazole. Answer. A. Vancomycin. Question 17. Which medication can lead to serious hepatotoxicity? A. Acetaminophen. B. Ibuprofen. C. Naproxen. D. Aspirin. Answer: A. Acetaminophen. Question 18. Which medication requires monitoring for signs of serotonin syndrome? A. SSRIs. B. Beta blockers. C. Antihistamines. D. Proton pump inhibitors. Answer: A. SSRIs. Question 19. Which drug can cause QT prolongation, leading to arrhythmias? A. Ciprofloxacin. B. Digoxin. C. Amiodarone. D. Furosemide. Answer: C. Amiodarone. Question 20. What major side effect is associated with aminoglycosides? A. Nephrotoxicity. B. Bradycardia. C. Hypotension. D. Hyperglycemia. Answer: A. Nephrotoxicity. Question 21. Which drug requires regular INR monitoring due to its effect on blood clotting? A. Warfarin. B. Aspirin. C. Enoxaparin. D. Clopidogrel. Answer: A. Warfarin. Question 22. Which drug is commonly associated with causing gingival hyperplasia? A. Phenytoin. B. Metformin. C. Levothyroxine. D. Propranolol. Answer: A. Phenytoin. Question 23. Which class of drugs can lead to Stevens-Johnson syndrome as a severe adverse effect? A. Sulfonamides. B. Beta blockers. C. Proton pump inhibitors. D. Statins. Answer: A. Sulfonamides. Question 24. What major adverse effect is associated with amiodarone use? A. Pulmonary toxicity. B. Hyperglycemia. C. Hypotension. D. Bradycardia. Answer: A. Pulmonary toxicity. Question 25. Which drug requires caution due to risk of rhabdomyolysis? A. Atorvastatin. B. Metoprolol. C. Lisinopril. D. Furosemide. Answer: A. Atorvastatin. Question 26. Which drug may cause peripheral neuropathy with long-term use? A. Isoniazid. B. Doxycycline. C. Furosemide. D. Ranitidine. Answer: A. Isoniazid. Question 27. Which drug can lead to severe hypokalemia if not monitored properly? A. Furosemide. B. Spironolactone. C. Losartan. D. Metoprolol. Answer: A. Furosemide. Question 28. What potentially fatal complication can result from heparin-induced thrombocytopenia? A. Thrombosis. B. Bradycardia. C. Hypoglycemia. D. Hypotension. Answer: A. Thrombosis. Question 29. Which drug can cause significant weight gain as a common side effect? A. Olanzapine. B. Fluoxetine. C. Lorazepam. D. Metformin. Answer: A. Olanzapine. Question 30. Which drug requires monitoring for risk of thyroid dysfunction? A. Amiodarone. B. Furosemide. C. Ciprofloxacin. D. Diazepam. Answer: A. Amiodarone. Question 31. Which drug can cause fatal hepatotoxicity in overdose? A. Acetaminophen. B. Warfarin. C. Metformin. D. Loratadine. Answer: A. Acetaminophen. Question 32. Which drug class is most associated with drug-induced lupus? A. Hydralazine. B. Statins. C. Proton pump inhibitors. D. NSAIDs. Answer: A. Hydralazine. Question 33. Which drug can cause a disulfiram-like reaction when taken with alcohol? A. Metronidazole. B. Amoxicillin. C. Doxycycline. D. Azithromycin. Answer: A. Metronidazole. Question 34. What serious adverse effect is linked to long-term use of proton pump inhibitors, PPIs? A. Osteoporosis. B. Hypoglycemia. C. Hypertension. D. Hyperkalemia. Answer: A. Osteoporosis. Question 35. Which drug can cause cyanide toxicity at high doses? A. Nitroprusside. B. Atenolol. C. Losartan. D. Omeprazole. Answer: A. Nitroprusside. Question 36. Which drug can lead to serious nephrotoxicity if not properly monitored? A. Amphotericin. B. metformin. C. Ranitidine. D. Propranolol. Answer: A. Amphotericin B. Question 37. Which drug is most commonly associated with causing hemolysis in G6PD deficient patients? A. Sulfa drugs. B. Beta blockers. C. Calcium channel blockers. D. Statins. Answer: A. Sulfa drugs. Question 38. Which drug should be avoided in patients with peanut or soybean allergies due to formulation ingredients? A. Propofol. B. Warfarin. C. Metformin. D. Atorvastatin. Answer: A. Propofol. Question 39. Which drug requires monitoring due to the risk of malignant hyperthermia? A. Succinylcholine. B. Metoprolol. C. Lorazepam. D. Ranitidine. Answer: A. Succinylcholine. Question 40. Which drug is known for causing priapism, a prolonged erection that requires medical attention? A. Trazodone. B. Sertraline. C. Loratadine. D. Omeprazole. Answer: A. Trazodone. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.